Hi, my name is Katherine Goss, and this is my bone video. This is a right clavicle, also known by some people as a collarbone. It is an S-shaped bone that curves forward and then back. This is the lateral or acromial end, and this is the medial or sternal end. You can tell this is a right clavicle because the smooth surface faces up and the flat end faces lateral. This is a right scapula. You can tell when you place it on your back, the socket faces lateral in anatomical position so that the humerus can attach. This is the posterior surface of the scapula. Here you have your supraspinous fossa, the infraspinous fossa, and the spine. You also have your inferior angle, your superior angle, your lateral border, and your medial border. Over here, you have your glenoid cavity or fossa, your acromion process, your coracoid process, and on the anterior surface you have your subscapular fossa, and here you have your suprascapular notch. This is a left humerus. It is the upper bone of the arm. You can see by looking at the head that it points medially to the body in anatomical position. Again, you have the head. You also have the anatomical neck and your surgical neck. You also have the greater tubercle and the lesser tubercle. In between is your intertubercular groove. On the lateral side of the humerus is the deltoid tuberosity. You also have your lateral epicondyle and your medial epicondyle. This is the capitulum and this is the trochlea. You also have the radial fossa and the coronoid fossa. On the posterior side of the humerus, you have the olecranon fossa. This is a left radius. It sits in anatomical position lateral on your forearm. Up here you have the head of the radius, the radial tuberosity, the neck, and the styloid process, which points towards your thumb. This is a left ulna. It sits medially in anatomical position on the forearm. Here you have the olecranon process, the trochlear notch, and the coronoid process. Here you have the radial notch. Down here is the head of the ulna and the styloid process. Here you have a hand. These are your carpals, metacarpals, and phalanges. For your carpals, on the proximal row, you have the scaphoid, lunate, triquetrum, and then pisiform. For the distal row of carpals, you have the hamate, the capitate, the trapezoid, and the trapezium. On down to the metacarpals, you start at the base, which is here, and the head here. Your fingers, the digits are listed from 1 through 5, from lateral to medial, starting with the thumb being 1, 2, 3, 4, and 5. Each digit, 2 through 5, has a proximal, middle, and distal phalanx. The thumb is different because it only has a proximal and distal phalanx. When looking at some of the carpals unarticulated, first you have the scaphoid, which you can tell, the hint is that it's shaped like an S. The pisiform, which hints at a P shape, and the hamate, which is almost like a hammerhead. Here you have a right pelvic bone. This is your pubic symphysis, your pubis, your ischium, and your ilium, your acetabulum, and obturator foramen, and your ischial tuberosity. Here you have your iliac fossa and your iliac crest, your greater sciatic notch, and your lesser sciatic notch. You also have your ischial ramus, inferior ramus, and superior ramus. Here is your ischial spine, your anterior superior iliac spine, your anterior inferior iliac spine, your posterior superior iliac spine, and your posterior inferior iliac spine. Here you have a left femur. The femur is the largest bone in the leg and in the body. You can tell this is a left femur because the head or ball of the femur faces medially towards the body in anatomical position. This is the anterior surface, and here again you have the head of the femur, the neck of the femur, the intertrochanteric line. Down here you have the patellar surface, your medial epicondyle, and your lateral epicondyle. On the posterior surface, you have your greater trochanter, your lesser trochanter, your intertrochanteric crest, your gluteal tuberosity, the linea aspera, the lateral condyle, and the medial condyle. You also have the intercondylar fossa. Here you have a patella, which is the scientific name for kneecap. Down here is the apex where the point is, and this is the base. To tell if this is our left or a right, you point the apex inferiorly and set the posterior surface down. If it leans to the left, it's a left. If it leans to the right, it's a right. Here you can see it is leaning to the right and is therefore a right patella. Here you have a right tibia. You can tell it is a right because the sharp pointed surface faces up, and this point down here faces towards your toe. First, you have your medial condyle, your lateral condyle, your tibial tuberosity, the anterior crest, your medial malleolus, and your intercondylar eminence. Here you have a fibula. An important thing to remember about the fibula is that the pointed end is distal in anatomical position. Here you have the head, the neck, the shaft, and the lateral malleolus. This is a foot. These are your tarsals, metatarsals, and phalanges. The first tarsal is your calcaneus, then your talus, your navicular, and your cuboid. And then you have your medial cuneiform, intermediate cuneiform, and lateral cuneiform. For your metatarsals, this is the base and this is the head. The digits of the foot are numbered 1 through 5 from medial to lateral, starting with the hallux or big toe, being 1, 2, 3, 4, and 5. Digits 2 through 5 each have a proximal, middle, and distal phalanx. The hallux or big toe is different because it has a proximal and distal phalanx only. For the arches of the foot, this is the lateral longitudinal arch, the medial longitudinal arch, and the transverse arch. These are some of the unarticulated tarsals of the foot. The first is your calcaneus, which is the largest tarsal of the foot, and this is the heel of the foot where you would step when walking. The second largest tarsal is your talus. When studying this tarsal, you should remember to think tallest or on top. The next one is your navicular, and the best way to remember this is to think that it is boat-shaped.